So my name is Domily Campbell. I was born and raised in Brooklyn, New York. I am a product of public school, New York City public schools. Both of my parents were educators in the public school system in New York City. I did my undergraduate degree at State University of New York at Stony Brook, and I went to medical school at Temple University School of Medicine in Philadelphia. Was too far south for me, so I promptly came back to uh, as close to New York as I could get and wound up in northern New Jersey at Jersey City Medical Center, uh, which is where I did my obstetrics and gynecology training and where I met the two prior panelists. And so uh, my primary practice is in obstetrics and gynecology. In 2014, because of some of the work that I was already doing, I gained some interest in gaining additional certification in what's called addiction medicine. And so that's really the practice and treatment of women with substance use disorder. Um, and also, right now, new for me is I am the medical director for the New Jersey Department of Health's Maternal Care Quality Collaborative. Um, my interests really lie in health advocacy for underserved minority populations, trying to find ways to improve health literacy. And I have general interest in basically group prenatal care, promoting and supporting breastfeeding, and in the care of women with substance use disorders, particularly in minority populations. I know a lot of people think that this is a problem of suburban women and suburban families, but we do have substance use disorder in urban communities and in communities of color, and it is woefully undertreated.
Um, Terry, Dr. Johnson, I think she's, are you on?
Me?
Yeah.
To hear me?
Yes.
Yes, we can.
Hi, I'm Terry Johnson, and basically I trained at the George Washington University for undergrad medical school, and also for my fellowship in neonatology. After I finished my fellowship in neonatology, I moved to New Jersey to take a job at Hackensack University Medical Center, where I remained the associate director there for 12 years. After that, I went to South Jersey to direct the Community Medical Center Hospital in their Department of Pediatrics Neonatology. I have a master's in public health and I have an MBA. And my primary interest throughout my training in medical school has always been pediatrics and maternal child medicine. So I like to call myself an advocate for all women during childbearing age. And my goal and my hope has always been the opportunity to have a healthy child, a dream of every woman that wants to have a child, and basically, in my mind, a right.
Thank you all so much. As you all can see, we have a very diverse panel here that are advocates both in public health and for our communities. So we're just going to start off with some introductory questions and then get into the questions that some of you submitted. So our first question that was very common and what students kind of want to know what's going on are what have been your experiences as physicians specifically related to COVID-19?
Okay. I practice I'm a laborist, meaning that I go to a hospital. I don't have my own patients, but I cover the labor and delivery unit for the time that I'm there. And I think that in the beginning in March, uh, it was even in labor and delivery very overwhelming. think, because we didn't understand the virus. There were concerns about equipment and safety. We definitely didn't know what the effects, and we still don't, the effects really on a pregnant woman and her newborn. Um, and the whole hospital experience, being in there and constantly hearing the code blues and calls for respiratory therapists and teams throughout the day. And and listening also to my friends who were actually in the emergency rooms and in the ICUs, and actually had that, this that post-traumatic stress, basically syndrome, from going in and out, not having real breaks because they were taking uh, place of other physicians and caregivers who were either sick or couldn't come to work, etc. Um, and I think uh, it, it not only takes a physical toll, but it takes an emotional toll. Now, over the past couple of weeks, as I noted to one of my friends, I noticed that I was in the hospital one day and I didn't hear a code blue. And that was the first time in months that I had not heard a code blue during a shift. And I was like, wow, we actually may make it through this, for the time being.
So this is Dominique Campbell. I can tell you about my experience. Um, I think, it was a once in a lifetime experience. And I think, as was stated, um, I think it was just emotionally a very difficult one. Um, in my practice, I work at University Hospital in Newark, New Jersey. So that was one of the initial hot spots. Um, and the hospital overnight turned into kind of what I call looked like a war zone. They had several tents that were set up outside um, because it was just overnight. We had so many patients in the emergency room. Um, and the emergency room is pretty busy, so they're used to being quite busy, but I mean it was really overwhelming. There were just patients everywhere, and once the ICUs got filled and the hospital got filled, the emergency room was just filled with patients that were waiting to get into bed. So that was a pretty overwhelming experience. On our obstetrical side, there was a lot of fear from patients about COVID. And in the very beginning in March, we didn't know a lot, and information was changing on a daily basis. And so it was really hard to communicate with patients, and people were just fearful. On our outpatient setting side, um, we saw a lot of patients, a lot of pregnant women who weren't coming for care because they were fearful about coming to the hospital. And so even until today, that's creating some gaps in care. Um, and then, um, you know, I have two school age children. So on my personal side, my daughter who was at boarding school was back home and she wasn't very happy about that situation. And my son, who is in the fourth grade, who is now learning from home. And it was a lot for them because, again, They were at home just kind of navigating a space by themselves because myself as a physician, I had to go to work every day, and my husband's also a physician, and so he was at work every day, and so kind of overnight they just kind of were doing things on their own, and so it was pretty overwhelming. We've made it through. We're resilient, and we've proven that. But I think that from a care side, particularly a care side for um, underrepresented minority populations, there are going to be very long-lasting effects. Just in regards to a lot of social determinants of health, access to care, food insecurity. And these are all issues that many of my patients were dealing with before COVID. And unfortunately, there are going to be some long lasting effects, job loss, just a variety of different things.
Thank you both. Dr. Hutchinson or Dr. Johnson, would you like to also answer?
Yeah, so I worked through COVID as well, not as I was seeing patients throughout. So my practice is focused on quality of life issues and so a lot of incontinence, urinary incontinence and prolapse. And so part of the non-surgical treatment of prolapse involves the use of a device. And those were the patients that I had to see because the device, I needed to care for them uh, more often than 6 months. Typically, it's a 3-month visit. So I was able to communicate with patients by telemedicine to find out what symptoms they were having and try and triage individuals as to when they must come in or when we can wait for a little longer period. I did do call on labor and delivery as well, which caused a lot of anxiety for patients, staff, and myself included, because in the beginning, we had no idea who was positive. We did not have testing initially. And we would find out thereafter that, oh, that person was positive. And because of the environment, you felt exposed. But I tell you, once we learned that your protective gear was crucial and used it well and had access, whether it was from donations or from the hospital, I think we learned how to rely on those things to keep ourselves safe and did provide good care. Fortunately, I wasn't deployed to the emergency room. I worried about that for days, but the anxiety cannot be expressed, totally expressed, the fear that you're going to take something home to your family. So I'm glad I'm not like Dr. Campbell with young children. I was able to isolate until I could maintain testing and know that I was negative before my husband would come by or my children. So I was very fortunate that way, but it does created a lot of anxiety. And working with the group and our ability to try and provide and and advocate for minority individuals, people who are at risk, was very helpful during this time. Still is.
Dr. Johnson, would you like to answer as well?
Yeah, from the point of view of my practice, I'm a neonatologist, which means I'm basically an intensivist. So I take care of babies, and a lot of the times they can have some relatively complex risk. However, during the COVID, the initial parts of COVID, all of the babies whose mothers were positive were really sent to the NICU or special care nursery, and the neonatologist was responsible for their care. So, of course, there's always the concern whenever there is a child, basically, what does this mean short term and long term? Because there's ongoing developments, particularly of the neurologic system, the respiratory system, and the GI system. So today, I remained as concerned as I was before as to what it really means for the babies whose mothers carried them COVID and were COVID positive, if anything, and certainly for the few babies that we actually identified to be COVID positive. Although they were not clinically ill during the time, meaning they had no symptoms or signs, we don't know what this means long term. And so they're going to require some specific follow-up that overall we're still trying to establish. Now, for those who are at risk or vulnerable, of course, the overall concern will be short term, will they be able to receive the care that they need? And long term, will they receive the follow-up and supports that may be needed in and around development? So we have a lot of work to do, and we have to do a lot of education for the mothers and fathers so that they can ask the right questions and be appropriately prepared to advocate for their children if need be. As far as my own experience, this took me back to the early parts of my training when we were just beginning to identify HIV/AIDS. And it was a very scary period of time in which, basically you're committed to taking care of patients, and we always rise to do so, but it's also very scary for yourself, for your health, and for your family. And so there's an overwhelming amount of stress that we've experienced. And I think at times, for me, it was very overwhelming. We're doing better now because we think we understand how to protect ourselves. We're doing better, and we understand how to protect patients and their families. And so it's a matter, again, of what it always comes down to: good, excellent communication, and appropriate science. And I think that over the next year or two, we're going to, begin to understand this virus, and it will be contained, but the challenges will remain, and, particularly for people who are vulnerable for many years to come. A lot of people lost primary caregivers. They lost jobs. They are economically at risk from the point of view of their health. They had already chronic conditions that now have been even more so exposed during the COVID frame or time period, I should say. And basically, we as an overall community have once again had the opportunity to understand that the disparities of health and the unconscious bias that leads to some of those things is really very real, and that we are at risk and that we must address those things moving forward.
Thank you so much. I think it's very important and amazing, but also very frightening just hearing all of your different perspectives and your different fields, and how, as we mentioned in the beginning, it intertwines so much with both your personal and professional lives and those that you care for on a regular basis. And even with the students that are on here now, they may be in those specific positions as well, whether they may have some type of pre-existing condition, or family members do, or they're caretakers, or they have siblings that are home. So I think it's just amazing, but also very interesting in showing how it intertwines and shows up in all of our different lives in different ways. Moving past this question and kind of bridging it to our next topic, what have been kind of your reflections and thoughts surrounding the social unrest and injustice, kind of the bridge that and the impact that it has had specifically in relation to COVID-19, whether it's specifically the killing of Breonna Taylor and Ahmaud Arbery and so many other names um, um, in the past before them, as well as those that aren't brought to light or talked about in the news. What are some of your reflections and thoughts on those?
Who is it? Amelie's going to speak.
You can go ahead, Dr. Bennett.
I'm going to speak, but you
No.
know, we on many level, as a Black woman in America, I can say I've experienced I have experienced different treatment because of who I am, and it happens every day, really. And I find that we always knew and were told to somewhat, if you're stopped by a police, you're just not going to argue, you're going to be safe. And that actually in October, just when I got back from China, I had an accident in on the turnpike. And I stopped at the side of the road. I knew I was supposed to. I pulled over and I stayed there. And the trooper came up. And as he's walking to me, I'm telling myself, I'm already scared, very nervous, but I was not going to argue. I just took my license and registration. I handed it to him. He took it, went away. He came back. He handed it to me, gave me a ticket. And I was just about to argue the ticket. And I said, you know, I'll deal with it. I took the ticket. He called a tow truck and I left because I just was so afraid to get in. And it was daytime, but I was there by myself. That's how I felt. And I said, I know better. So it was very unfortunate to see what happened to Floyd. And I must say, we experience this more often than we are willing to say and admit. As a Black physician in a medical school and doing clinical rounds on the floor, I will be walking into a room with 4 resident physicians, they're trainees in my specialty, and they may all be white, and the patient would look at me as the student, you know, knowing that, and the residents would say, oh, this is my boss. And I hate when they use that term, but as the attending physician, I would say, no, I'm the attending physician. And the person will come back and say, oh, nurse, even though you may have introduced yourself as a physician, because the mentality for some is that you could not have achieved that ranking or that level of education. So some of this is not new. As far as the Floyd experience goes, you know, it was just unbelievable to watch. And I think it brought a lot of sadness to me personally when I did the white coats for Black Lives and took the knee. And I truly didn't realize how long 8 minutes was. Being on my knee as an old lady on my knee for that long, it was pretty dramatic. And it was just surreal. And so I felt that even though I was watching the things around me and what people were experiencing and saying, just that experience made it so much more personal. And I can understand what is going on. So Dr. Johnson talked about communication. We really do need to open the communication. We can't hide how we feel. We can do it in a nice way to say, no, we're not all lazy or trying to steal something. And yes, you have role models or people of color that can do positive things as well. I have to stop because then I'm going to get really emotional here.
So this is Terry Johnson. It was a tragedy, but they happen every day. This one just happened to be much more publicized, and I think we have to say technology remains front and center, and we have to remember that as a community and have a lot of gratitude for cell phones and body cams. Otherwise, although this has been discussed for a long time now, we probably would not know anything about Mr. Floyd's death that would be substantial. But this time, it's front and center. Everyone can see it. The question is, what and how does the community respond to move the issues forward? So for me, it's very important, again, that we present the issues at hand and have the hard conversations appropriately. I support Black Lives Matter. Everyone's life matter. Okay? That's the way I feel about it. However, we have to realize, okay, that if we're going to come to the table, nobody will meet us there with violence and destruction. And so I understand the frustration, the pain, I'm telling you, is overwhelming. The feeling of insecurity and anxiety. I have two nephews that I love dearly, and I was so scared and so nervous for so many days, telling them not to get into arguments with the cops, just do what they say, don't go out, things like that. And it takes a toll on us, short-term and long-term, the stress. But we've got to channel the energy into positive communication and process. And that's going to be very important if we're going to move the issues forward. So I'm hoping that we will begin to see more and more leadership emerge that will help us to bring these issues forward and to actually get some policy in place that's going to help long term. But it's a lot of work to be done. And for every one that we know, 2 or 3 that we never hear about. I also am an advocate for diversity. Can bring everybody to the table. Right is right and wrong is wrong. That's what I was always taught.
So this is Dr. Campbell. I think for me, it was very painful to see what happened to George Floyd. Actually, like I said, I grew up in Brooklyn, New York. Both my parents were school teachers, and my father actually was a grassroots advocate. And so this concept of police violence and police brutality is something that, unfortunately, we have grown, my sisters and brothers, we've grown up advocating against for a long time. There was a young man, Randolph Evans, that I remember very clearly, who was shot by the police. And there's so many more between Randolph Evans, when I was 14 years old, and now George Floyd, when I'm 50. And so it's almost like a knife in me, because I feel like over the course of so many years, so many things have changed, but then there are so many things that are the same. And, I think that just in talking about COVID, we saw the over policing of certain communities, people being beat down because they weren't wearing a mask. when just a few months ago, had they been wearing a mask, somebody would have been clutching their purse as they walked down the street from that same person. So, I am in a lot of conversations where there's a lot of microaggressions being brought forward. Why are these young people not doing this? Why are these young people not doing that? There's a lot of microaggressions where we talk about, the violence that occurs at some of the marches, and that certainly is not anything that any of us would condone. But we're not talking about the economic violence that occurs from so many Fortune 500 companies that are not paying people a living wage, because that's robbery, that's thieving. Um, so, you know, um, as a mother of two, and I could say, a Black male, but my daughter is 15 years old, and we see that this violence is also being perpetuated against women. And so, whereas maybe a few years ago I would be mostly concerned for my son, I'm concerned for both of my children, because unfortunately I realize that their education, that um, that their ability, they live in a suburban community, um, doesn't protect them from these type of situations. And 8 minutes and 46 seconds is just such a long time. And it's just unfathomable to me to think that somebody could do that, and somebody saying, I can't breathe. And not only the person who did it, but the people surrounding and watching. And now you have the gentleman who says, well, I told him that maybe they should move him, maybe we should move him. But, the superior officer said no, you know. And so that makes me think, you know, just what will we stand by? What will we stand by and watch? And so when I took that knee for 8 minutes and 46 seconds, it was just unbelievable. It was just unbelievable to me as to how much time 8 minutes and 46 seconds is. And I don't think, I mean, it just really brought tears to my eyes. I don't think I could be hearing somebody say, I can't breathe. I can't breathe for that length of time and just stand by and thank God for technology.
I actually did not watch the video because I just couldn't bear it. I think growing up here, uh, there are so many acts of everyday acts of racism and social injustice that this actual murder, basically, I could not watch another Black man die just like that. I have two sons. I have a husband. I have a brother. I have brother-in-laws, nephews. And actually, like Dr. Campbell says, now it's coming to light. There are plenty of women that have died at the hands of police. It's just not as publicized. So there's issues in regards to women and women's rights too. But I think overall, I think we have to look at all our systems and say, what is going on, right? Systemic racism just is not within the police, right? Thank God, most of us probably will not have a violent occurrence with a police officer. But in our everyday lives, it starts in school, right? There's been actually a lawsuit settled just in Maplewood in regards to the educational system, where it's been shown that Black children were more likely to be in the lower class math, while their white counterparts would most likely, by the time they went to high school, go into the honors or advanced placement mathematics. And actually, they were able to, it was settled out of court. But basically, it seemed to be substantiated that, and I know from my personal experience with my children, that Black children are just not, um, should I say, nominated, because I think you have to be nominated in a lot of these schools by their teacher or referred by your teachers to these higher level courses. And it has nothing to do with your intelligence. So that, it starts then. There are all kinds of other little things that happen on a daily life that are problematic. Um, and then that doesn't change though when you go up into higher levels or you go into the corporate world, right? So even at colleges, you have professors looking at you if you go into a certain class like you don't belong, or because it's not expected that a Black person would show up for that type of class. Or the teachers that always ask all the Black students, even at higher levels, about Medicaid or welfare or, the drug system, et cetera, et cetera. All those kind of things are built into all kinds of systems, educational systems, that it doesn't stop, you know. And being a physician, as Dr. Hutchinson has stated, doesn't protect you against any type of discrimination that can occur, and it doesn't stop biases or statements being made. Right? People have, it's never happened to me, but I've had a friend who's been told, oh, that uh, she could not deliver his wife because she was a Black physician, but she was the one on call in labor and delivery. The woman was in labor, but it brings out all kinds of things, right? So what does the system do with those type of issues? Do they condone it and just bring in the white person? How do they resolve those? And how do they support the person that this has happened to? So those are some of the things that are still ongoing.
Thank you all. And I think this will also segue into some of the additional questions that students have. So I'm gonna, from the chat specifically, Ngozi had a question specifically about kind of similar to the topic that we're talking about right now. She says her concentration is health disparities, and a common theme she's come across is an allostatic load and diminishing returns regarding minorities, specifically Black, health outcomes and educational attainment. A specific article reviewed in class was by Geronimus, showcasing empirical data of Black women having a higher allostatic load than Black men, and white women, as well as an overall higher allostatic load for women versus men and Black people versus white people. The most chilling discovery was that a Black woman with a PhD has a higher risk of maternal mortality than a rural, low-income white woman in the U.S. Considering all of this, how do you handle frustration with the intersectionality of being a Black woman in a healthcare profession? Thank you, Ngozi.
This is Dr. Campbell. Yeah, thank you for that question. I was reading it in a chat and I was like, boy, she really is on point. So, and Ngozi, you're right. It's very frustrating. And, one of the things that I do in my professional career is I sit on New Jersey's Maternal Mortality Review Committee. And so we review all the deaths of women who die within 1 year of a pregnancy. And so you're very correct that um, that information is true, that even as we are well educated, we still have a higher maternal mortality. Um, so how do we deal with that frustration? Once I found that out, I um, was talking to some of my friends. A friend of mine who is like a lieutenant in the police department, a friend of mine who has a PhD, she's a physical therapist. And I was asking them, are they aware of of this risk? And it was a surprise to me that they were not. And so, what are the steps? I think, one of the important things is for us to educate ourselves. In so many classes in public health and medical school, we're told, black low income, black low income, black low income. And I feel like what ends up happening is we just equate black to being of low income. And so that's why it becomes surprising to us that even when as black women we're not of low income, that we still have this risk. Um, and the reality is that when we notice that this risk, and we have noticed that this risk still exists for women who are well educated and of are of high income, it really just points to the systemic racism in society um, that we don't even recognize. There's a woman by the name of Melissa Harris Perry. Um, I know she's like a commentator on, I think, MSNBC, but she talks about economics a lot, and how when you work at McDonald's, a crappy income is a crappy income, whether you're a woman or whether you're black, whether you're white, you're getting a minimum wage. But it's so shocking to know that at higher levels of education, that black women are being paid much less for the same work that others are doing. And so, again, it's another disparity that occurs. Um, and the other thing that I think we need to address as Black women is the superwoman mentality, as I will call it. We're taught growing up, suck it up. This is how it is. You gotta, you just gotta do it. That's how I was taught. Um, we're strong and we can just take it. And we end up bearing things and not looking for help, not asking for help. Um, because this, we don't want to show this weakness. I don't want to I don't want to be weak. I don't want to let anybody see me sweat. I'm so fortunate. I can think about my pregnancies and, how fortunate I was to be surrounded by not only my family, but my friends, and my professional friends who knew that I wasn't a superwoman. Um, and you need that support, and we all need to support others that we know and make sure that they're educated about the issues and make sure that they're asking questions, and that they're not just assuming that their doctor or that their healthcare provider knows what's best. We hope they do, but it's we can still educate ourselves, we can still advocate for ourselves, and we must advocate for ourselves.
I think too, even a bridge to Ngozi asked a question prior to that as well, in reference to Iron Triangle, which is a concept used in health administration representing quality care and access. Unfortunately, COVID-19 has exacerbated the health disparities prevalent in the U.S., leaving marginalized communities and more vulnerable populations regarding healthcare. Moving forward, in addition to her other question as well, for those that weren't able to answer, what steps as aspiring current healthcare professions can be proposed in efforts to increase optimal healthcare outcomes as this pandemic progresses? I know we've touched on it a little bit, but if that can also be kind of answered in combination with her initial question as well.
I know I should let the obstetricians take this question and comment, but I must comment that, talking about advocating for yourself and being informed, I think that's key. Pregnancy in itself is a vulnerable time, and during this COVID time, with fear and probably lack of information, or hopefully not lack of outreach, that uh, 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 people would continue to go for prenatal care, because during those times you can be evaluated and risked out, and your risks can be managed. Particularly hypertensive disease it's common in Black people, and with pregnancy, it can be exacerbated and can have serious effects on the pregnancy and delivery and postpartum outcomes. So, if the culture or that community fears going for care and is not evaluated, you're really putting your pregnancy at risk. And getting the information for self-help to do with that, nutrition, of course, and being able to afford nutritious food is important. But the system is such, if you don't show up for care, you're not going to get the supplements either. So I think that information has to be brought forth, a community supporting each other with information, and taking someone to wherever they need to go for that care. It doesn't have to be every week, but there has to be some contact with trusted healthcare providers that will guide you to minimize some of those risks. It may not remove it. Again, as a physician, I had outcomes that were unpredictable for someone who has healthcare, So it just is. We are high risk. We need to be informed. We need to support our community and give that information and provide certain screening that can be helpful.
I think the health disparities, especially the Black maternal mortality, is one of the reasons that we formed our association. Uh, we know we may not be able to do everything as an individual, but you can do a lot as an organization. You have different people that have different talents, who have different networks, uh, and you deal with the, in this case, Black maternal mortality, uh, educating, advocating, and mentoring. Right, are the three things that we are strongest as an organization. It's essential that we, as Black professionals in medicine, need to educate our communities. Uh, it has been shown over and over again that health outcomes are better when a Black patient is taken care of by a Black physician. There is a trust that is developed just because of that. And we understand why. If you understand the history of medicine and the things that were done to Black people in the name of science, okay, there's a distrust in the medical system, along with things that occur on an everyday basis. So we are here as an association to say, okay, these are the things that we see. These are the things that we can tackle, and this is how we're going to do it. And so that's what we've been doing as an association.
So we have about 15 minutes left. There is one additional question that someone had asked when they registered. So I'm going to ask that one. So we touched a little bit on discrimination in the workplace and some experiences that you all have gone through. An additional question, which I think a lot of students academically here, especially in this session, may experience imposter syndrome, both on the academic side as well as and some of their opportunities that they get, whether they're shadowing, doing research in the lab, or even, as you said before, just going to class and not being expected to show up on time or even be in that specific class, whether it was back in high school or middle school and now being at Rutgers. So what have been some of your experiences with imposter syndrome? Do you still experience that? How did you kind of combat and work through that? How are you currently working through that? So what are some of your responses about imposter syndrome?
So this is Dr. Johnson, and I can honestly say that the preparation basically to move through school, get your education, go to college and medical school, really hopefully has to start very young. It is a difficult environment, or mine was. For many, many months when I arrived in medical school, I was alone. I did not know how to communicate and integrate with the rest of my class. There was 4 of us in that class. And actually, the saddening part about it is the 4 of us were actually, for the first 4 months of medical school, we distanced ourselves from each other. And I lived in a world in which all I did was study, and I was very lonely. I didn't understand. But what was very beneficial to me is that I had a lot of self-confidence academically. And so I felt that on that level, I could compete, and I would do fine. But I always tell students, residents, fellows, the academics, by the time you get to that point, is not the question. Again, you've got to learn how to communicate. You've got to have some experience understanding how people in different cultures and socioeconomic classes operate. What is their mode of operation? Okay? And you need to be very aware of that, such that you can move through, achieve the things that you want to achieve, and be heard. It is a time in life that you incrementally develop these talents, but a lot of people get lost and a lot of people don't recover. So I suggest that everyone finds a mentor that can help you replay. The first time that when I was a senior fellow and I had written a policy and a procedure for a new treatment in respiratory care of the neonate, and there was an 18-year-old white male dying, for which they asked me, and the family signed to use it experimentally. So I was the only one in the hospital doing it. They called me and asked me if I would try, and I said, yes, of course. I left the NICU to go to the pediatric intensive care, and when I arrived there, the nurse berated me and went on to tell me that the trash had been overrunning all morning, and that she was going to report me to the supervisor, and I needed to get it. And what do? Remain focused. I said to her, I'll be glad to get the trash after I get this young man on nitric oxide. No problem. Because you have to decide which battle you're going to pick and which ones you will just ignore. Some people are absolutely ignorant. Another time, I went on a transport 50 miles by jet to pick up a baby. I walked in the room in the outskirts of Washington, D.C., and the mother looked at me and she point blank told me, ain't no nigga taking my baby nowhere. Okay. All right, she's made her statement, so what do? I called the hospital and I said, you need to send another team. The baby's critically ill, and I don't know that the baby will survive until you get here, but we need to try. Those things come with emotional intelligence, which I suggest everyone read a book on, and also the ability to be able to go back and to talk to someone and express it, because it's stressful. And that stress eats and eats and eats at your very health, mental and physical. And so I think that when we begin to understand, and we have a lot of understanding now as to why the outcome for educated Black women is so different, professional Black women, it's the stress. It's a hard life. And we have to know that. And we have to find outlets. And we have to respect ourselves like this. I'm not a superwoman. We can't do it all. You have responsibilities at home. You have responsibilities at work. And, you know, we hear now a lot of people talking about work-life balance. Sometimes I think we need to take a class in work-life balance, because many times as we grow up, there's really none. We work to survive, but we have to come to a point that we put ourselves first and that we understand that there are challenges that we have to meet every day, but we also have to understand what and how to have some kind of outlet in our lives to deal with it. And mentorship is very important. It helped me tremendously. And my mentor was a woman in her late 60s, white. She had worked with the Black population in Washington, D.C. for 35 years. And the last thing that she said to me when I left my fellowship, she set myself down and my colleague. We were both two Black women. And she said, one thing I need to ask you to remember, both of you have superior educations, and I'm proud to let you out into the world graduating from this hospital. But I'm going to let you know something. When people look at you in the hospital, they don't see their granddaughter, they don't see their daughter, and they don't see their mother. And if you remember that and understand it, life will be easier. And I'll never forget that. They can't reflect. They don't see you. They don't understand. That's the work that yet has to be done.
I think in life, I always say I grew up in a suburban portion of New Jersey, very well off town. They called our neighborhood, because it was basically Blacks and poor Italians, they called it the ghetto. Okay. And but the school was majority white, well off. The greatest education that I actually got was understanding that world, how to function and how to exist in the white world. So when I came to college, I had already gone through it. I had many friends that I met in college at Douglas who came and couldn't exist. It wasn't the classes, it wasn't the subjects. It was existing in the microaggressions, the biases, the actual racism that existed. They couldn't deal with it. And they dropped out, went to other schools. Some just dropped out. And so there's a tremendous loss that occurs because of the prejudice and biases that exist. Um, and you need to be able to sometimes compartmentalize them in order to continue to function. You, especially, being in medicine, you're dealing with all types of people, and and this includes your colleagues, right? So you have to be able to handle it. You have to kind of be able to understand it. And what Terry said is really true. You need other people around you to mentor you through this. You can't, You can do it by yourself, but it's very hard. Um, but there are enough of us out here now and that are willing to mentor and help out. I'm done, Domily.
Okay, sure. So, yeah, I mean, I would just add, um, you know, dedicate yourself to excellence. And I agree, because our patients, my sisters, my kids are going to need you, and so um, I need you to keep pushing yourself forward. Um, but don't lose touch um, with the fact that in the end, we're all human. And I think that that's really important for me. What has been um, so special is really being able to sit down on the side of a patient's bed and, say, I have a sister and I wouldn't want anything more or less for you than what I would want for my sister. Um, and that concept of treating people the way that you want to be treated. I absolutely agree with everyone about getting a mentor. And the mentor doesn't have to be a person of color, because I think that if the person is offering themselves to be a mentor, they certainly have their heart and have their desires in the right place, right? So you get a mentor where you can. I think for me, one of the mistakes I probably made in medical school is, I was a little bit more fortunate than Dr. Johnson. I think there were 22 underrepresented minority students in our medical school class, and we tended to stick together pretty tightly. Um, and that was a mistake in a little bit of a way because, some of these kids in my medical school class of 200 out of the 22 of us, we were all the first people going to medical school. Some of us were the first people who had gone to college. And we were up against students who their father was a doctor and their grandfather was a doctor, and they knew exactly how to get through the exam. And here we're struggling, trying to figure it out amongst ourselves. And had we probably just been a little bit more aggressive about making friendships with other folks, and it took me a little time, and eventually I did, um, I think, make more friendships with people because, of course, in medical school, you might have your friends that you study with at home, but when you're in medical school, you're put in groups with different people. And there was a young woman who, for whatever reason, she really liked me, and we became friends. And but she would tell me, well, so and so's over there, they, their father was a physician and they recommended this book because it just has all the answers and it's cut straight to the chase. Or they have these old exams that people are getting questions and studying from. So once I was introduced to that world, I realized they weren't smarter than me. They just had some different resources than I had. So I more recently, I guess in my maturity, what I'm learning is that I want to be more like the majority population. I have to believe in myself. I can do it. I can do everything they can do, because their knowledge base is not any greater than mine. It's just the opportunity. And so now I have to give myself the opportunity where I can. Somebody offers me an opportunity, I'm not going to think twice. I can't do it. I can do it.
I know we're nearing our 8:15 time.
Sorry,
Um,
Dr. Hutchison. Let me.
no, it's completely fine. It was expected with the conversations being heavy and intuitive. I know, Anaya, you had a question, so I'm going to read it for those that are on the phone and can't see the chat. And then we'll probably open for maybe like one or two more questions if you all could stay on for another 15 minutes. So Anaya asked, I'm a very religious person. For those who are also, how did you keep faith during the process of microaggression and discrimination? Even now, how do you keep faith?
Pray, pray, pray. And continue to, whether it was daily devotions or I would, at least during medical school, actually also during college, I wasn't able to attend church as much as I could, but I had enough faith that I was there for a reason. Between that and my parents, right? I knew that I could carry on, um, and prayer, uh, to help me in whatever obstacles, to see the light, to maybe look at something different because maybe it's not what I expected, but there's another avenue that's been opened, and then saying, okay, I'm going to walk with faith and go through with that. Um, it is, yeah, it's just prayer and faith. But I have to say before we get off, I, your presence here on this call is definitely appreciated. Understanding that there are plenty of patients and out there that are so looking forward to you becoming a doctor or whatever else you may want to be. Um, my One of my greatest supports were the people that did the cleanings in the hospitals and the medical school, the security guards, the people in the cafeteria who would
Mm,
feed my butt when I had no money. Uh,
mm,
all those people, Doc, let me go clean your room. Da da da. I want to make sure you sleep on a clean bed, Doc. To this day, I'm saying those are the people that brought the greatest support to me and the eyes of the patients. That when you told them, Black patients, Hispanic patients too, you told them you were their doctor, their smiles, they want to pray for you. I mean, people used to look, and to this day, sometimes I walk in and people are like doing the thank God dance. That's, it's not, has nothing to do with me. It is because of our health disparities, and they want to pray for your well-being and to lift you up and to lift the people up around you.
I just want to quickly add about the prayer because as my friends know, that I've been very religious pretty much all my life. And I grew up with my parents telling me prayer without works is dead. So you can't just pray. But and so I made sure I strove for excellence. I would pray before I study, pray before the test. Don't forget the religious piece, but you have to do the work. Believe in yourself, do the work, and then pray along with it because the prayer will help you. And you, just because you are trying to achieve some higher education, you can still maintain your religious base and your faith, because people who you come in contact with may appreciate it so much. There are
mm,
patients who I'm going to operate on them and they'll say, Doc, pray with me. You know that prayer before they go to sleep does something for that individual. So it's okay to have faith. It's okay to be religious in whatever aspect, branch of religion you use, or you express your spirituality. It's okay. You can always help someone spiritually as you help yourself. Thank you guys for such thoughtful questions and insight.
Thank you. We just had one last quick question that was asked in the registration. With all that happened in COVID, which I'm sure is a question for all the students on here, a lot of programs were canceled, both shadowing programs, internship programs, research programs. So what are some opportunities that you all know of, both passive or very like experiential based, that are available going on that students can kind of participate in during these times?
So it's a hard question because you're right. A lot of things are canceled. There may not be the same opportunities in formal research projects, fellowships, and on-site experience. But when you're preparing to take care of people in the community, there's always that opportunity to go into your community. And you can do that without structure. Right now, you must do it and be safe. But there's always an opportunity to volunteer. Even if you're volunteering, say, at a soup kitchen, it is an opportunity to learn and to engage with the people that you will be taking care of, and to understand their life, to understand their needs, and to also to understand yourself. And so you don't have to have a formal experience. Okay, those will come, and we certainly hope that as COVID resolves, or we get it under control, I should say, you know, those opportunities will come back. But never miss the opportunity to go into the community, and never miss the opportunity to just you can go to a daycare center, watch the children play, watch their mothers, understand what they have to do to get there every day. Do something in your religious organization. Volunteer at a food bank and understand food insecurity. Those are the things. And volunteer at a clinic too. There are many things to do. All of those add to your ability, again, to communicate and to reach out and to meet people where they are. When you can meet people where they are, you can understand them, you can listen and you can hear, you can do a better job as a doctor.
I think too, if I can jump in on the academic side, for those where it's time, this is the time to also study for those MCATs, for the GRE where there's limited distraction, you're not taking classes, as well as possibly working on those specific materials of what you need to apply to medical school or your allied health profession, whether it's getting your resume critique, working on your interview skills. Yep, Dr. Campbell, working on your resume, doing your interview skills, working on your LinkedIn page, working on that personal statement. And for some of you, it may be even the beginning of the stages of figuring out what schools you even want to go to. So looking and doing some research of what schools are you actually interested in, how far do you really want to go, and what financial needs may you need when you get there, whether it's scholarships you have to apply to, or does a school offer specific financial aid packages. So this is the time to also do that research where you wouldn't necessarily have the time during being physically in school, physically at school. But does anybody else want to jump in about specific opportunities for students?
This is Terry again. I want to say one more thing. Let's try to begin to develop the skills to engage the legislative bodies. It's a time to write a simple letter about something that you're concerned about, because that is one thing that I think we don't really engage in so much. And you would be surprised how many of your colleagues are very engaged and have been since they were very young, and are able to use that to benefit their communities and themselves.
I would say in addition to that, you know, very important skills as far as just communicating with people and all of the other experiences, but other things like making sure people are registered to vote, making sure that people are participating in the census. Again, it gives you an opportunity to learn why that's important, because if we're not counted in a census, if we're not voting, we can't we can't hold our legislators accountable for changes that we expect to see. There are also organizations where people are calling folks, seniors who are shut in. And again, it goes to communication, because that is so important in being a physician, is learning how to communicate with different people, people of different ages. So those would be my suggestions.
There are a lot of grassroots organizations that are working within communities. Many of them tend to be political in nature at this time because it's a presidential election, but it's also a way to pick up skills on how to advocate, but also how to network within that type of system. But I've done a lot of grassroots work on the political side. It also gives you a way of strategic thinking through problems, right? Because the campaigns or the groups have a problem and they want to solve it, and you actually learn and see uh, how that thought process and how, occurs, and you develop those type of skills sets also. And it's a great way of networking with other people. You'd be surprised, or maybe you would, but how many people you come in contact with through that type of grassroots organizations.
Well, thank you all so much. Thank you to our guest speakers, Dr. Brew, Dr. Campbell, Dr. Johnson, and Dr. Hutchinson. Um, so we will be having a few different speaker series after this. We'll be having one next week, next Thursday, with Dr. Levine at 4 p.m. She's an emeritus professor of internal medicine and hematology at Albert Einstein College of Medicine, and she'll be talking about prevention and treatment of coronavirus specifically, because that is her background. But thank you so much to our guest speakers for tonight. We had some great conversation. Apologies for anyone that we didn't get to your specific questions. If it's okay with the speakers, we can share their contact information. So if you have any other follow-up questions, you can reach out to them. For my students, there will be an evaluation that is sent to you via email following this meeting. You must complete that evaluation to get the recording of this presentation to ensure that you complete the evaluation, as well as the contact information for our speakers tonight. Thank you all so much for joining us tonight. Hope you have a good evening.
Thank you for the opportunity.
Thank you.
Have a great night.
Have a great night, everyone.
Thank you again for your contribution to our students' education and really for an inspirational evening. And I want to thank you personally for what you do for our community. If there's anything the college can do for you and your association, let us know. This is a very important conversation for us, for our students, for me. I'm deeply grateful. And thank you for all you do.
Thank you.
You're welcome.
And thank you to the students for coming
you.
out and attending in their summer days and summer hours and participating in the questions. if you all wanna, the physicians, if you guys wanna drop your email in the group chat, you can do that as well.
I hope I did it right.
Yeah, you did it. You're good, Dr. Beard. You're good.
But you have
Thank
my
you.
contact information,
Yes.
so please feel free to share.
Of course. And
Thank
Dr.
you,
Johnson,
everyone.
I'll reach out to you to share yours as well.
Okay,
Thank you so much. Thank you for having us. Thank you.
Thank you all so much. Have a good night.
Good night.
Thanks.
Yeah.